everyone, and welcome to another live with Dr. Sue Dyson. I am Megan Phillips of the Train with Trust Project, here with Jody Ambrose, co-founder of the nonprofit Train with Trust Project. And we are joined today by Dr. Sue Dyson, renowned equine veterinarian, orthopedist, researcher, and author. And we wanted to tell you a little bit more about the Train with Trust project. I am pretty much going to be running things in the background, so I wanted to go ahead and put up our PowerPoint slides as we get started here and tell you a little bit more about the Train with Trust project. We are a nonprofit organization. We are dedicated to making information about animal behavior accessible to everyone. And we are also committed to civil discourse and conversation about topics that can sometimes be contentious, but understanding that we can all come together with different viewpoints and learn new things and learn new perspectives and work together for the betterment of horses, horse welfare, and the betterment of the lives of the people who work with horses. So that is our focus as a nonprofit. And we have been producing these live conversations with Dr. Sue Dyson for about a year and a half, going on 2 years now, since the 24 Behaviors of the Ridden Horse in Pain, Shifting the Paradigm of How We See Lameness film was released. And we wanted to keep that conversation going to help educate more people about the use of the Ridden Horse Pain Ethogram and how we can best listen to our horses. So we have a lot of content available on our website for free, and that includes a field guide to the 24 behaviors, and that includes illustrations and summaries of what to look for those behaviors. We also have checklists with some key points about how to best implement the ethogram or the Ridden Horse checklist as you go along. We also have additional checklists. There are more behaviors that can indicate how your horse is feeling and what is going on for your horse. So we have all of these available through our website. So please be sure to avail yourself of those. And again, if you like what we're doing, we are a nonprofit. Feel free to send us a donation. It's greatly appreciated. And to those of you who've already sent donations as they've been coming in, we really appreciate you. With that being said, we're going to move on here and start discussing our topic for the day, which is interpreting head and neck behaviors under saddle, focusing in on a few specific behaviors included in the Ridden Horse checklist. So as I mentioned, I'm going to go ahead and be in the background. I'll be taking your questions on Facebook if you've got them for us, and feel free to put them in the comments and we'll see if we can get those answered. And I want to go ahead and turn this conversation over to Jody and Dr. Sue.
Okay, thank you. And as Megan said, I'm Jody Ambrose. I'm a dressage trainer and a co-founder of the Train with Trust Project. And I'm excited to talk about this topic today. I think it's a topic that gets discussed a lot, but only in very specific contexts. I think as a dressage trainer, it's a topic that comes up for me a lot, but usually in relationship to specifically horses' head position, whether it's behind the vertical or if there's like a head tilt or too much movement. When I first started out in dressage, I think a lot of conversation was had about horses being above the vertical. And I think that the fact that that comes up a lot is an indication of the fact that these are very noticeable behaviors. So I want to talk to you, Dr. Dyson, about what the relationship is between these things that we notice and what's going on with the rest of the horse, what specific behaviors may mean about either what's going on with the rest of the horse or the rider, and how to also maybe apply these things to other disciplines besides dressage, because I don't think it comes up quite as often in the disciplines where maybe the specific judging is not is not focused on head and neck position as much or in the same way. So to start out, can you give us a little bit of an overview of what the behaviors you pay attention to that are included on the Ridden Horse Pain Ethogram are, and what we're going to get a little bit more in depth on today?
So we have got a number of behaviors that relate to the head and neck. We have the head being tilted repeatedly, the head moving up and down on a repeated basis, or the head moving from side to side. And then the head being either above the vertical position, more than 30 degrees for 10 seconds or more, or the head being behind a vertical position, more than 10 degrees for 10 seconds or more. And these are all behaviors that may have potentially more than one cause, but were included in the Ridden Horse Performance Checklist because we've demonstrated that the majority are at least 10 times more likely to be seen in a horse with musculoskeletal discomfort compared with a comfortable horse. But we have to bear in mind that it's the total checklist score that's important, not the display of any of the individual behaviors that we're going to be talking about. So if we go to the next slide and think about a head tilt, the head being tilted to one side, in the picture on the left, the pole is to the left and the nose is to the right. This could be because the horse had discomfort in its mouth, but we always check in advance before evaluating horses to determine that there is no lesion or damage within the oral cavity that might potentially cause this type of behavior. And we know that when we remove the source of pain, be it a hind limb lameness or a forelimb lameness, this propensity to tilt the head to one side usually disappears rapidly. Most horses who do tilt their head do so repeatedly in one direction on one rein. It may be in the same direction when they change the rein, or it may be in the opposite direction when they change the rein. That's a variable feature among horses. But if we see it, we have to say, is it happening repeatedly? Think about the circumstances under which it's happening. We often see it in the movements that horses find more difficult. So if we compare the horse going around the periphery of the arena versus a 10-meter diameter circle, it's more likely to be seen in the 10-meter diameter circle. However, this horse on the left is clearly just in a straight line. What I want to differentiate between is this horse has a tilt of its head, and we can see that the left ear is lower than the right. So even if I was to see this horse from the side, because the ears are asymmetrically positioned, I'd be able to say that the horse must have a head tilt. But this is rotation occurring at the pole, with the rest of the neck being reasonably straight. And I want to contrast that with the next slide. We move on. So in this horse, we can see that the pole is tipped to the left and the nose to the right, but the entire neck is tilted. So it's almost as though the horse has placed its entire neck on one side. And this is a horse with primary neck pain. And this was a show jumper. And the reason for clinical presentation was because the horse put its head to one side, particularly in canter and particularly when approaching fences. So when you're approaching a 1.40 meter fence with the head more severely tilted than this and the neck, it was somewhat alarming for the rider. In addition, this horse showed a low-grade left forelimb lameness. And this is important because this left forelimb lameness was associated with the neck pathology. So there was nerve root compression causing the left forelimb lameness. And forelimb lameness, which is associated with the neck, is often typified by the fact that if you perform various nerve block techniques in the lame limb, the lameness actually gets progressively worse and worse, which was the case in this horse. And there's also a pattern. We tend to see that, for example, this horse is tilting its nose to the right in association with a left forelimb lameness. And when we have neck-related forelimb lameness, almost invariably, the nose will be tilted in the opposite direction to the lame forelimb. So this horse had a left forelimb lameness, and its head and neck were tilted with the nose to the right.
And to clarify for people that maybe haven't been down this road with this type of pain, you're talking about blocking the actual limb where the lameness is, and we don't block the neck, right?
No, we tend not to block the neck. It is possible to infiltrate local anesthetic solution around these nerve roots, but it is technically rather difficult. And we don't want to run the risk of local anesthetic solution affecting the spinal cord in any way, because that cause transient wobbliness or transient loss of function of the limb. So we tend to go with a set of symptoms. And together with Dr. Monica Allman at UC Davis, we did last year publish a large study when we looked at the clinical features exhibited by horses with neck pain or neck-related forelimb lameness or neurological problems related to the neck, and compared them with a group of control horses. And we were able to identify a number of clinical features which were much more common in the horses with neck problems than the control horses. And one of it was this tilting of the head and the neck.
Interesting.
So shall we move on to the next topic? So this is the movement of the head up and down, not in rhythm with the trot. And that's important because we know that a head nod can signify the presence of forelimb lameness. So if you have a forelimb lameness, the head will go down when the sound limb hits the ground, and then will come up again as when the horse changes the diagonal. But that is in rhythm with the trot. If we have random movements of the head, either like the horse on the top, which is a pretty extreme example of marked tossing of the head upwards and downwards, or you can have much slower changes in head position. So the horse goes slightly above the vertical and then puts the head in a vertical position and then goes behind the vertical and then raises its head again. That is also counted as repeated changes of head position, although it's not this aggressive head tossing that the horse in the upper images was performing. And this can make these horses rather difficult to ride if it's severe. And some horses are presented just because they are head tossing. People are not aware of any other problem, but they realize they cannot control the horse properly. And therefore the problem needs investigating. Now, sometimes the answer is very straightforward. An ill-fitting saddle can cause a horse to toss its head up and down, and change of the saddle will immediately mitigate this behavior. So we don't have to be necessarily saying there's an underlying serious musculoskeletal problem. It may just be that the horse's saddle is inappropriately fitted. So, for example, there's not enough clearance at the withers, or the tree points are too tight, or there's not enough space between the back of the shoulder blades and the tree points of the saddle, such that as the limb is brought forwards and the shoulder blades rotate backwards, they hit effectively the tree points of the saddle, which causes discomfort, and the horses react accordingly.
So can you clarify for people that are using the ethogram to evaluate their own horse, if they see a horse that looks like this horse on the top, what criteria would they use to determine whether this is up, down, or above the vertical?
Well, this horse, in fact, sometimes went behind the vertical. So this horse, you would say, and we would have to see a video recording of it, does it for a period of 10 seconds have its head in front of the vertical more than 30 degrees for that 10-second period? If it does, then that behavior is one behavior, and then this constant changing of position of the head would be another behavior. So the horse would then score 2 of the 24 behaviors.
Yeah, I think that's a really important point that, it has to do with, you've emphasized already multiple times, but I think sometimes people sort of miss this point that it's about the duration and it being repeated over and over again.
Yeah. So the horse might be changing its position of its head slowly, but doing it multiple times during, for example, an 8-minute work session, and that would certainly count as repeated changes of head and neck position. And the causes are hugely variable. I've mentioned ill-fitting saddles, but it could be due to hind limb lameness, it could be due to forelimb lameness, it could be due to back pain. We have to investigate further. None of these behaviors are specific for any particular source of pain. So you have to go through a process of elimination, which is done through a thorough clinical evaluation.
Yeah, that's a really important point, that the behavior by itself doesn't indicate the exact source.
No. And let's go on to the next slide. Because this horse, you can see it's wearing a nose net, and its head is going sometimes to one side or the other. And at times this horse would flick its head very quickly to one side. And that behavior is more typical of what we call head shaking, which is usually due to abnormal sensation in the trigeminal nerves that innervate part of the face. So a horse could, and I've seen this recently, both be a head tosser because it had musculoskeletal pain and a head shaker because it had trigeminal mediated problems. So a horse that I looked at recently was reluctant to go forwards, had poor hind limb impulsion, and on palpation, the horse showed an abnormal reaction to pressure over the jumper's bump, which was suggestive of a component of lumbosacroiliac joint region pain. So the horse was owned by a vet, and she blocked the sacroiliac joints, and that made the horse much more willing to go forwards. But there was still some residual movement of the head, which looked more like trigeminal mediated head shaking, because now the horse occasionally picked up a forelimb as though to hit its nose with its forelimb. And I put a nose net on the horse, and it actually got worse. And then we blocked the infraorbital nerves behind the eye, which effectively blocks the trigeminal nerves, and the horse was substantially improved. So that horse had head tossing behavior because of its lumbosacroiliac joint region pain, but also was a typical head shaker. So occasionally we do see these horses with 2 different types of head movement for 2 completely unrelated causes.
Well, so that really emphasizes the importance of looking at these behaviors in the context of the whole horse, and not just focusing in on trying to treat one behavior at a time.
Absolutely, yes. Yeah. Yes. Let's look at the next slide. So I've already talked about an ill-fitting saddle. Clearly, this saddle on the right has negligible clearance of the withers. I was taught as a young child that you needed to be able to get 2 fingers underneath the front of the pommel when you were sitting in the saddle, and when you were standing in your stirrups. This rider couldn't get more than 1 finger in under the pommel. So clearly this was a pommel that was much, much too low. Other factors that we need to consider are the movement of the rider's hands. is the rider actually inducing movement of the horse's head through inadvertently moving their hands? And my observation is some people just are not aware how they're moving their hands constantly.
Mm-hmm.
If you show them video footage of it, they can see it, but they can't feel it. They've become so used to the fact that their hands are moving in an asynchronous way that they're completely unaware of it. And therefore, in those circumstances, when I'm not sure what's going on, I will either ask the rider to ride on a loose rein, or I will get the rider to hold on to the neck strap to try and stabilize their hand position and see what happens to the horse's head movement. I did see a horse very, very recently, which was ridden by what was considered to be an upper level dressage rider, and the movement of her hands was excessive, I felt. And I think that she was trying to create an outline for the horse's head and neck. And when we took away the horse's hind limb lameness, the horse moved much better, and immediately its head was much more still, and immediately the rider stopped moving her hands.
Mm-hmm.
She wasn't aware of this. She was an upper level dressage rider. She wasn't aware about the way in which she was moving her hands, nor was she aware that she had stopped doing so as soon as the horse started to go better, which is intriguing to me because we tend to think that dressage riders have good feel. But my observation is that there are some very effective producers of dressage horses who are well liked by judges, but they don't necessarily have full awareness of what they're doing with their bodies.
Yeah, I think that's right. I think and I think in both my work as a dressage trainer and working with you on issues surrounding these behaviors, my observation is that the tendency is to initially blame the rider for these kinds of things, because that is something that as trainers we have more control over. Before handing the issue off to a veterinarian, we want to try and fix the rider. And I think it's really important for people to realize that it does go both ways, that sometimes you can identify something that the rider is doing, but it may actually be going the opposite direction, that it's not causing the horse's behavior. The horse's behavior is causing the rider issue, and that it's much easier to ride a horse that is sound than it is to accommodate the movement of a horse that's unsound.
Absolutely. I have ridden many lame horses belonging to clients before and after the use of nerve blocks, and I felt incompetent riding the horse before the nerve blocks because I didn't feel I could communicate with the horse. But once you remove the pain, suddenly you are more at one with the horse. You're more of a partnership, and they are much, much more responsive to cues.
Yeah, I absolutely agree with that. And not that it's not important to, as you said, be, identify asynchrony, and I had an interesting conversation with a client a couple of weeks ago about, we were watching a clinic together, and the clinician kept saying, quiet, quiet. And she said, well, what is quiet? Like, does that mean that I should just, keep my hands perfectly still? And I think the word you used was asynchrony. It's about moving with the horse's movement and following. And that's a piece that tends to be missing in a lot of riders, where they are moving their hands with their body, not independently, and they're not following the horse's movement. Specifically in the walk and the canter, the neck oscillates, and people think they're supposed to keep their hands perfectly still, but then they're moving against the horse's motion, because as the horse's neck moves, the hands don't move with. And so there's lots of layers to peeling away what it is that's happening between the horse and rider, and not just assuming that it's the rider's fault, and also not just assuming that the solution is to fix the hands and don't let them move.
Yeah. Let's move on to the next, which is a related behavior, which is the head moving from side to side. And this again can be something that's happening constantly, as it was in the horse on the left, or it may be a much slower movement from side to side. We always have to bear in mind, once again, that this can be influenced by the rider, and there may be external factors, such as flies, for example, that may be irritating the horse and causing it to move its head like this. So let's move to the next slide. So in this instance, we can see that the horse is moving its head much less than we had seen in the previous photograph, but the horse these are more or less sequential frames coming down the long side on the right rein. But if you look at the position of the rider's hands, you can see that her hands are constantly changing in position. So if you look at the far right picture, you can see that the right hand is higher than the left hand. It's held upright, whereas the left hand is palm down, and the left hand is much lower than the right. So the question here is this again the movement of the horse's head, the influence of the rider, or is the rider being influenced by the horse, and she's trying to keep the head in a more stable position but not being very successful? And again, this is the sort of circumstance when, if I was evaluating this horse from a clinical perspective, I would want to see the rider maybe hold a neck strap or go on a loose rein. And I also look to see if there's a difference in different paces, because sometimes the horse's head will look much more still in canter versus trot, and the rider's hands will be more still as well. So again, it raises the question, which is the chicken and which is the egg?
Mm-hmm.
And it's a matter of a process of elimination again. But we can't.
Can you go ahead?
No, you go ahead. That's fine.
I was going to say, can you clarify again for people using the ethogram, at what point would you classify this as a head tilt versus side to side?
That's a good question with respect to this, because I wouldn't want, just looking at these pictures, to call this a repeated head tilt, unless I could be sure that it wasn't the influence of the rider's hands, because this is one I'm really not sure about. And I want to see if, when the rider's hands were more still, did the horse try and tilt its head or did it not? So it becomes a judgment call. I mean, it's very easy to think that there should be black and white answers for everything, but sometimes it just comes down to a judgment call.
Yeah, I think that highlights the importance of really doing this practice of evaluating, taking the time to look at a horse on a regular basis and see them for a length of time on different days and train your eye, because initially when you first just started trying to apply these behaviors to a specific horse, it is sometimes a gray area.
Yeah, and I think we have to talk a little bit about what we do to advise the rider if we think that the rider is indeed the culprit. Can we go to the next slide? So we can think about the confounding factors. We've already mentioned flies. We've already talked about discomfort in the mouth. But we have to regard the movement of the rider's hands. And I think that in the short term, I can offer holding onto a neck strap or asking the rider to bridge the reins. But I think maybe you, Jodie, could talk a little bit more about improving core stability, and perhaps going on to the next slide as well, Megan.
Yeah, I think as a trainer, you have to always go back to basics with every rider, no matter how advanced they are, and determine that they have the proper core strength and the proper independent seat. It's a term that, whether it's, the old days it was Sally Swift and then Mary Wanless came along. There's a lot more emphasis on biomechanics than using that term than there used to be. But I think it's always been the case that the importance is for the rider to be able to stay balanced on the horse's back and move with the motion of the horse without being thrown off balance, and then to be able to separate their arms and hands from that core, from their body, also be able to move their legs independently, that it doesn't twist the body. And those are hard things to learn when you're also dealing with a horse that may not have the best balance, may not be completely sound, the saddle may not fit, and a lot of people are in a hurry to go jump or go do dressage movements. And, I don't think there's a riding instructor alive who doesn't recognize that before you do those things, it's really important to develop an independent seat. And sometimes that takes the assistance of other professionals. I know I have a crooked spine, so I do physical therapy and go to human body workers to try to help myself stay as balanced as I can. I used to teach a lot on a simulator, like you see in the bottom right-hand corner, which was great because I could physically touch people and position their bodies. And then they also had a screen where they could watch themselves. It's a great tool. I wish there were more of those around. But there's sort of the low-tech versions of those that you see on the top there, a balance ball and one of those stools that you can use. There you see different gadgets. Some involve video, like Pivo and Coach's Eye. There are the belts and the elastic connectors and things like that. They're all different tools that may be able to assist people in becoming more aware of that proper balance and being able to use their body parts independently to move with the horse, not just be still, not just be quiet, but follow the motion in a mechanically correct way. And as you said, be aware. For me, video was really critical when I was coming up as a young rider. My trainer would film me. It was in the days before, Pivo, before, everybody had a camera on their phone, but we would film ourselves and then go home and watch. And my trainer would point out the things that I needed to work on. Those are really critical pieces, not just to becoming a good rider, but to influence your horse, and be aware of how you're influencing your horse properly, so that these tools for identifying unsoundness are that much more effective, because you can separate the influence that you're having versus what may or may not be due to unsoundness.
And I think it's really important to remember that the saddle must fit not only the horse, but also the rider.
Yeah, that's a great point.
I see so many situations in which the saddle does not fit the rider, which immediately places the rider potentially out of balance. And unless they are very good and can adjust accordingly, they are not going to be moving in synchrony with the horse, despite their best efforts. And that's just because the saddle doesn't place them in the most appropriate position. So we have substantial evidence to demonstrate that this is a really common problem and needs to be addressed to help the rider, to make it easy for the rider.
Yeah, I think that's an area that really does need to be more consistently addressed. I hear people a lot of the time say, well, the saddle fits the horse, so it doesn't matter that it's uncomfortable for me. I've also seen a trend towards saddles that sort of hold the rider in position. And I think that I'm not a big fan of being forced into position. It should fit you in a way that is comfortable, that you don't have to fight against the saddle to be in the right position. A good saddle will just feel natural. You won't have to think about it.
Yes, and we also face a situation when saddles can actually induce discomfort in the rider. So that, and this isn't really talked about enough, I think, particularly, or for both men and women, that there are your perineal regions which can be damaged by a saddle. And
Yep.
that's going to make it really uncomfortable for you to ride. And these things need to be addressed, because if you have a saddle that fits you better, then you can avoid these problems.
Absolutely. And affects the horse as well. I got a sale video yesterday of a rider posting on the cantle of the saddle, and that whether the saddle fits well or not, if the weight, every other step is coming down on the back of the saddle, that's got to be super uncomfortable for the horse as well. So I think that's a really important point that needs to be addressed more, is that it's not just bad for you if the saddle doesn't fit you, it's bad for the horse as well.
Yeah. Let's move on to the next slide. So I just wanted to ask you, Jodie, do you have any experience of these bands that are marketed for encouraging riders to keep their hands closer together and more still?
I do not, unless you count the sort of low-tech old school version, which was that they went in the 80s when we wore scrunchies in our hair. They used to put the scrunchies around our wrists to hold them still like that. So I think it's an old idea with the new technology. I think it goes back to what we were discussing earlier, that it might improve awareness of what's happening with your hands, and it might help keep the hands still. But stillness isn't necessarily the exact goal. The exact goal is for the hands to be independent of the body and move with the horse. And so I think their usefulness exists, but maybe limited.
Yeah. Okay, let's move on to the next behavior, which I think is head above the vertical. So this is defined as the head being above a vertical position more than 30 degrees for 10 seconds or more. And this is something that we see commonly in horses, particularly those with back problems or hind limb lameness, perhaps a little less often with forelimb lameness. There often give away clinical signs that the horse is constantly moving in this way by the development of the muscles of the neck and back. Because with the head in this elevated position, it's going to have a huge influence over the entire movement of the rest of the horse. The horse will not be able to engage properly the muscles of the thoracic girdle. It will not be able to flex the thoracolumbar region, the area underneath the saddle and just behind the saddle, and it will find it difficult to properly engage the hind limbs. So it has multiple follow-on effects which are detrimental to the horse in terms of its ability to move, detrimental to the horse in terms of its muscle development or loss of muscles because they're not using them appropriately, and also potentially inducing secondary pain because of this abnormal posture. This is one of the behaviors, and we know that if we take away the underlying pain, then the horse will almost immediately be more willing to put its head into a vertical position, or even sometimes behind the vertical. Some horses we see, and it's about I think about 24% of horses who've had their head above the vertical position before we've done the nerve blocks to take away their pain. And when we take away their pain, they actually drop their head behind a vertical position. It's almost as though they've said, oh, what a relief, I'm feeling more comfortable. And they start to move through their backs much more, but their head drops behind a vertical position because that's where they then feel most comfortable. And also, I think it's something also to do with their muscle strength and coordination can't perhaps hold them in a more position, so they drop behind a vertical position.
Yeah, I think this one is an interesting one. I think I alluded to this earlier, that when I first started riding dressage, it was one that was called out frequently. I think dressage was not as popular in the United States, and there weren't as many good trainers. And so you would often see horses that weren't using their backs and would be hollow. You also saw a lot of poorly fitting saddles and maybe unbalanced riders. And so you would see a lot of horses above the vertical. And it was judged very harshly. And so I think the pendulum swung, and that sort of steered people in the direction of riding more behind the vertical, which then became the thing that was that called out more often. But lately, since there's been so much emphasis, I think in the last 10 to 15 years, there's been so much emphasis on the incorrectness of behind the vertical, which we're going to talk about. I'm starting to see more people ride purposely above the vertical without the back muscles engaged and the core muscles lifting, and seeing more weakness, and seeing more horses purposely being ridden sort of hollow and above the vertical, and people assuming that that is more correct because of all the emphasis being placed on horses being incorrectly behind the vertical. And so these two things go hand in hand, that, like you just said, that to develop the horse's muscling correctly, there's a position where they should look somewhat neutral, and that's where comfortable horses will go without a lot of effort from the rider.
Yeah, I think if you look at some of the good dressage horses, for example, at the Los Angeles Olympics, which was a long time ago now, but there are several pictures of horses that were very successful there, and their heads are slightly in front of the vertical. They're nothing like 30 degrees, they're probably more like
Right.
10 degrees. But it shows that the horses can be produced in that way, and they can still move effectively, and develop the right muscle movement patterns. So I think we have to think that there's a happy medium, but head above the vertical or head behind the vertical more than 10 degrees for more than 10 seconds are potentially signs of discomfort. So
Yeah,
let's move on to head behind vertical.
I was just going to say real quickly that also emphasizes how important it is to train your eye to see that angle, because I think we throw these terms around a lot without really specifying the 30-degree angle and also the 10-second duration. And it takes some time to be able to spot what 30 degrees looks like.
Yeah. So let's move to the next slide, which is going to be head behind the vertical for more than 10 degrees for 10 seconds or more, exhibited by both the photograph on the right, the photograph on the left, and the picture on the right. You will see that in the picture on the right, the rider's reins are slack. There isn't normal rein tension. And people say, well, maybe the rider's pulling too much, but frequently the horse will place its head in this position spontaneously and as a reflection of discomfort. And I will often see, if a horse is going around the periphery of the arena, the head may be in a vertical position, but if I ask the rider to do 10-meter diameter circles, the head will immediately go behind the vertical as the horse finds this movement biomechanically more challenging, and it reacts by putting its head behind the vertical, not because the rider has asked it to put the head there. The rider is powerless in this situation. They cannot influence the position of the head and neck, whereas many good jumping riders and many good dressage riders can influence the position of their horse's head. They will say, I can work the horse with its head in front of the vertical, say 15 degrees. I can work it with the head in the vertical position, or I can work it with the head slightly behind the vertical. And all of which can be mixed and matched throughout a work period, therefore using different muscles in the horse's body, which has to be a good thing, in my opinion.
Yeah, no, I completely agree with that. And I think it's interesting, you even see, with the trends towards people doing bitless and even bridleless riding, you'll see some riders that can change the horse's head position even without that bit contact. And you'll also see horses choosing to go more than 10 degrees behind or more than 30 degrees above, regardless of the fact that they don't have bit contact.
Yeah, I think that's fascinating. I watched a dressage rider riding an intermediate test without a bridle.
Mm-hmm.
And the horse, a lot of the time, had its head behind the vertical position.
Mm-hmm.
Not a large amount, but it was behind the vertical position all the time,
Mm-hmm.
despite there being no influence of the bit or the reins. It's where the horse chose to be.
Yeah. Yeah, I find that fascinating. And then also to look at like what other behaviors are they exhibiting in the
Yes,
context? Does the rest of the horse look relaxed, or are they swishing their tail? Are they tilting? Those kinds of things.
absolutely, absolutely. Um, let's go on to the next picture, because I do think we have to consider how the horse has been trained to work and what discipline is it in terms of what is expected to be the correct position for that discipline. This is a Western pleasure horse. And for most riders who are not Western pleasure horse riders, they would think, wow, this horse's neck is in a really low position and its head is behind the vertical. But this was how this horse had been trained to go. And again, you can see that the rider's reins are looping. She has no effective rein tension other than the weight of the reins. But this was how this horse had been trained to go. But this was not a normal horse. This horse had an intense stare. It was repeatedly shutting its eyes. Its tail swished. It showed many other signs of discomfort. But this was the way in which it had been trained to move with this low neck position, so almost a horizontal position of the upper neck with the nose slightly behind the vertical. So I think we do have to bear that in mind with all of these different behaviors. How has the horse been trained? What is the rider asking it to do versus what is the horse doing as a reflection of an underlying problem?
Yeah, I think that's a really important thing to consider in terms of, I think I for sure tend to focus on dressage because that's my discipline, and you come from eventing, and so we talk a lot about horses doing dressage, but you have some experience using the ethogram applied to Western horses, right? Can you talk a little bit about that?
Yes, I went to the reigning cow horses futurity championships in Texas and spent 3 days observing Western performance horses. And clearly, a lot of them did experience discomfort, and they did show 8 or more of the behaviors of the Ridden Horse Performance Checklist. It was delightful to see that the winning horse of the entire championships was by far the most comfortable horse in terms of both its quality of movement and its Ridden Horse Performance Checklist score. So we can apply the Ridden Horse Performance Checklist to these Western horses as well as other horses. There are some confounding factors, though, because in that particular discipline, it is not illegal to block horses' tails,
Mm-hmm.
which is done in order to stop them tail swishing. And in those horses, you would see obviously no tail swishing. And in fact, the tails would be sucked in between the horse's hind limbs because it was just being held in limply, which was rather sad to see.
Mm-hmm.
And I think we also have to think that the dressage world gets the bad press about hyperflexion or roll cur. We're not just talking about head being slightly behind the vertical, we're talking about the head being to the chest. If you go and watch warm-up arenas in upper level show jumping,
Mm-hmm.
this is something that you will also see frequently. It is not a problem that is unique to the production of dressage horses. It's also seen in jumping horses as well.
And
And that's important
do
to
you think
recognize.
it's fair to apply the same standard to a jumper, as if you're watching them go around? Are there any special considerations that you would make if you were evaluating a horse in a different discipline besides yours?
I don't think so. If you watch the jumping riders just work on the flat, you can easily apply the ethogram. In a show jumping warm-up area, it is far more difficult to do so because they spend so much more time in either walk or in canter.
Mm-hmm.
You don't see them do much trot work. Perhaps that's just as well because some of them will show lameness in trot, which they conceal in walk and canter, and they jump despite that. So I don't think you can apply the checklist effectively in a show jumping warm-up area, but if you watch jumping riders work their horses on the flat, then certainly you can.
Sure.
Should we just go to the next slide? Because I think this is reflecting work we did with 150 horses that were presented for low-grade lameness stroke poor performance. And on the horizontal axis, we've got each of the 24 behaviors of the checklist, and highlighted by the yellow box are those behaviors we've been talking about today. And on the vertical axis, we see the frequency of occurrence of each of the behaviors. And the white boxes represent the frequency of each behavior before the use of nerve blocks. And the blue boxes reflect the frequency of those behaviors after nerve blocks, so that we can see that there is a substantial reduction in the frequency of occurrence of all of the behaviors. The behavior fourth from the left, which is head behind vertical, is the least reduced for the reason that I gave you before, that some horses which started with their heads above the vertical, then when pain was removed, finished up with their heads behind the vertical. But this graph shows that these behaviors, as with the other of the 24 behaviors of the checklist, are hugely influenced by the presence of pain. They are not habitual because as soon as we take away the pain, then these behaviors disappear or are markedly reduced in their frequency.
Such an interesting graph because it really highlights how much of a difference it can make, and also that not every behavior will vanish necessarily if you take away the pain, but that it will lessen some more than others.
Yes. And in different horses, you're going to see different reactions. And by and large, you start with a lame horse that maybe scores 9 of the 24 behaviors. And I would hope that after removal of the pain, we're going to reduce it to something like 2 or 3 of those behaviors. If I've only reduced it to, say, 6, it would concern me that I was missing something and that we needed to search for some other reason as to why the horse wasn't as comfortable as it should be.
Yeah.
So this shows, I think, how the checklist can be used by riders and trainers to identify problems, but it can also be used by veterinarians when they're doing investigations to determine whether or not they have or have not found all the problems.
Absolutely. And it brings up something we've talked about many times, which is how important it is for a veterinarian to evaluate a horse under saddle, because these are all ridden behaviors, not things that would necessarily come up on a standard lameness exam.
Yeah, absolutely. So I think we've come to the end of the points that I wanted to raise. I don't know if you've got anything else, Jody.
Yes. Jody, did you have anything else you wanted to add, or shall we wrap up?
I think we can wrap up.
I didn't see any questions roll in. Sometimes they roll in on a personal account and it's hard to go back and forth. But if you do have questions come up after watching this conversation here or on YouTube, go ahead and pop any questions you have into the chat and we will find a response for you. Before we wrap up, I wanted to go ahead. We've been talking a lot about the use of the Ridden Horse Ethogram and how important it is to watch your horse regularly if you're a trainer, to perhaps apply it to horses that you work with regularly, multiple horses, and of course for veterinarians, body workers, etc. Um, so Dr. Dyson, in partnership with Sue Palmer, put out the book Harmonious Horsemanship: Use of the Ridden Horse Ethogram to Optimize Potential, Partnership, and Performance. Dr. Sue, I believe this was a year or so ago, right, that this was
Yeah,
published?
that's correct. Yes, yes.
Yes, so it's available on Amazon. It's also available from harmonioushorsemanship.co.uk. And there are additional resources on harmonioushorsemanship.co.uk. So we highly recommend their website as well, all in the name of getting information out to people about how to optimize the potential partnership and performance of their horses and to better their own lives as well as riders. We will be doing our next conversation with Dr. Sue Dyson next month on July 17th. We typically do these on Thursdays. Every once in a while we don't, but you can kind of check back with us on Thursdays, and then we'll usually get that YouTube posted. If you're not able to attend on Thursdays, we'll get it posted soon afterwards. We have not selected a topic yet, and we are curious what topics our audience is interested in hearing about. We've gotten some questions or some requests from some of our viewers and listeners about topics that they would like to hear Dr. Sue Dyson and the Train with Trust Project discuss. So if you have any ideas or questions that have been rattling around in your brain, or ways that you would like to know about applying the Ridden Horse checklist or understanding these behaviors, or anything about understanding behavior while riding, pop that into our comments as well. We'd love to hear from you, and we will certainly be letting you know about the next topic as soon as it is selected. And again, we want to thank you guys for joining us. We really appreciate how much engagement we get on these, and we're so glad to be spreading the word about the Ridden Horse Checklist. And so if you are enjoying this work and you did want to provide a donation, please pop over to trainwithtrustproject.org or 24horsebehaviors.org. Both websites are operated by the Train with Trust Project. And get your free resources, many articles that Dr. Dyson shares with me that will be of interest to you all. And we will look forward to meeting with you all and seeing you next